I've been a practitioner now for 20 years. And in the first 10 years of working with different systems such as corrections, social services, child and youth mental health, I found that I was constantly burning out. I was burning out because the families, Indigenous families and communities that I was working with, it was almost like they were falling into the river. And once they fell in the river, it was difficult to fish them out of the river. And that's what caused the burnout, because I was trying to fish people out of the river. And in a way, I still feel like that in trying to address maternal-child health disparities or the opioid crisis, or trying to reduce injuries with elders in our home communities. And every day was a fight and a struggle trying to fish people out of the river. And I think that the role or the goal of public health is ultimately to go further upstream. It's about building those policies and those bridges across the river so that people aren't falling in. In order to address health disparities, colonial policies, and structural racism, we need to understand the normalization, legitimization of the historical and ongoing colonial system, as well as the social and interpersonal, political, economic, social, and cultural exclusion and marginalization of Indigenous peoples in this country. Ultimately, it's really about a hierarchy of privileging whiteness and disadvantaging, marginalizing, and excluding Indigenous voices, perspectives, and Indigenous ways of knowing, being, and doing in this world. And until we address those power imbalances, only then will we really tackle the disparities and inequities in our countries to ensure that we close the health gap. Some of the ways that we can action this is through education and awareness. Through education, we can challenge our misconceptions and misperceptions, and building awareness and capacity in terms of integrating Indigenous perspectives, ways of being, knowing, and doing. But this can only be done if the research and approaches are through community-based and nation-driven approaches. This is fundamental in order to work towards self-determination. Self-determination is key, but so is building relationships that are respectful and reciprocal, authentic, and works toward a common goal. And only then, I think, through these relationships will we really, bring balance to the power imbalances and disparities and inequities that have been perpetuated. I think we need to move beyond reconciliation and work towards reconciliation, and that these actions are like a stone thrown in water, whereby the change starts with ourselves and radiates out with our conversations and our relationships with our family, and building those relationships within our community and across our province and across our beautiful country and across the world, and working internationally with the rights of Indigenous peoples.